As the COVID crisis rages on, increasingly medical offices and practitioners are transitioning their patients to telehealth. I'm Erin Jackson with Jackson LLP Healthcare Lawyers. How do you transition your practice to telehealth? A huge consideration is insurance. First, does your patient's insurance cover the treatments you're going to be offering via telehealth? And second, does your insurance cover the treatments you're going to be offering via telehealth? That is, your malpractice insurance and your general liability insurance. You also likely want to consider getting a pretty robust cybersecurity insurance policy. Another big consideration for telehealth is Hipaa. Obviously, privacy and security, which are the two major prongs of Hipaa, are dramatically different if you're offering telehealth visits versus in person. They're not necessarily better or worse, but they do change. So you may need to update your Hipaa policies and procedures to accurately reflect the type of treatments you're offering and the type of practice environment you now have. Also ensure the software and the platform you're using are Hipaa compliant. You'll need to execute a BAA and confirm that they have compliant Hipaa policies and procedures in place. When transitioning to telehealth, you also need to ensure that you're obtaining informed consent from your patient to specific treatment via telehealth. Now, you may have already obtained informed consent from your patient at the very beginning of treatment. Say you have a patient you're treating for diabetes. You obtained informed consent at the first visit. You don't obtain new informed consent each time they come in. However, now that you're transitioning to telehealth, it is a different consideration because the way that you can examine that patient and the way that you can interact with that patient is different than when you're in the office environment. You need to obtain informed consent for telehealth. And it's important to discuss with your patient that they may need to still come into the office for certain things, certain visits, certain exams. Telehealth visits are generally not a replacement for in-person care, but they're a great offering when we're in situations like we are now. For tips on how to keep your healthcare practice compliant, subscribe to our YouTube channel.